Good evening, good day, everyone, and welcome to EK Podcast Show. As this show continue, we'll urge all our audience to subscribe to the video and register so that at any one point we release our audio, you will be the first person to listen. As usual, always send in your comment to know how we are doing here in the studio. Today we have some very special topic that we'll be presenting. Based on coronavirus, we'll be looking at the origin, how it started, how it's spreading, what can be done. As of now, we know that there's no cure, and we've invited one of our guests into the studio who is a nurse by profession. He's very versed, he has a lot of experience in working with this. We'll also be looking at how nurses can also prevent themselves, because every time we say, oh, the patient should prevent themselves. But what about these nurses that are the front line, that they receive all the patients coming in with all this disease that we believe to be spreading a lot of death, spreading from Europe to Northern America. Now it has hit Africa. There's a lot of misinformation. That politicians too, who are giving their own information to advance their political agenda. The economical impact of this disease too will also be discussing. Chris, you are welcome into the studio.
Thank you, Mr. Ernest. Thank you for welcoming me to your studio. It's my honor to be here, and we shall be discussing about the coronavirus. I think we can get started.
Yes, okay. Yeah, Chris, when this thing, first, when this thing started in China, it was like people just thought it was something that was localized in China. So at that time, I don't know if you were actually paying attention or not, what was your own first impression?
When the coronavirus first started, it sounded like any other flu virus, I guess, that affects us. And it has the U.S. that we live in. We know that the flu occurs every year, and people suffer. It comes and it goes like every other disease. I know there've been cases of other kinds of diseases out there that have come and gone. And I thought that's what the coronavirus was, and that unlike maybe Ebola and other diseases, is going to go away soon.
Yes, and I know you have a tons of experience in virus based on your biological background, where you've studied biology, pathophysiology, now advanced to age. At least we are very glad that you are here today. You'll be giving us a lot of insight. Oh, yeah, when this thing, they say some of the symptoms, but before we even begin to go into that, when this thing started, they said from some wildlife domestication, or people were rearing animals in the market in China. Then later on, there was some news that came that, oh, they were doing some laboratory testing with some animal bat in the lab. So that's where people get contaminated. We know that sometimes they also do in the virology lab, where they may conserve or keep some of these viruses and do research with it. Do you think that could be, what is the relationship between from the animal in the market to the lab? Do you have any idea, or what was it?
So, to my knowledge, the coronavirus, I mean, we know China is a pretty big country, and it's difficult to pinpoint where we can say the virus originated from. But what I have studied so far is that people have associated the coronavirus to a bat and to the pangolin. And the pangolin, as we know, is very special animals with gills that has circulated around the world. So I guess it's a hot commodity. It's almost like an elephant tusks, and people carry it around the world. So they said this pangolin had a certain genetic mutation of one of the SARS virus that had an epidemic in 2002, and it has about a 95% mutation from 95% mutation of the current coronavirus that we're suffering from. And they said, so the pangolin got that from the bat. Then the bat passed it to the pangolin, and then the humans who traffic pangolin contracted the virus from the pangolin, and that is how it started spreading.
So therefore, what I want to understand from you and for our audience to be clear, because you are explaining a lot of in depth now. So to be very put it in a very simple way, you are saying that the virus existed in some animal, the pangolin, but it wasn't a pathogen. It couldn't cause any disease or any death in those animals. But when the virus transmits into the human host, then
Yes.
it becomes an issue.
Yes. So, to my knowledge, there are certain diseases like in bats that bats carry around, almost like the mosquito carries around a certain infection. When it bites you, then it transmits malaria. But
Yeah.
the mosquito itself doesn't die from malaria; it just carries a parasite around. In similar way, the bat carries this gene that it beats the pangolin. Then the pangolin is being trafficked a lot by humans. There's only a small population of them around the world, and I guess the pangolin has healing properties, and that's why humans traffic them, and they don't tend to stay in the zoo where they should originally be. And there's what I guess is my opinion that humans contracted the coronavirus from the pangolin, which has about a 95% mutation of the coronavirus.
So now, so we can say the conspiracy that people were doing some lab testing, we could roll that out. I mean, for now, based on this information that you have, we could say that could be. I mean, the presentation that you are making make a lot of sense. So what Chris is saying is that, like in his analogy of the Anopheles mosquito, the female Anopheles mosquito, that transmits malaria falciparum, that causes malaria. That means the malaria exists in another human host, but when the mosquito itself is not infected, like the pangolin that you're talking of,
Yes,
itself is not infected, but it carries this coronavirus in his host. Then when it transmits into a human being, the human being now become infected. Okay, moving forward. Now, once this virus now is spreading, I know from the pharmacological point of view, targeting the treatment of viruses is looking at the life cycle, how it replicates. So you have some drugs like the inhibitors that inhibit the attachment, or when it attaches to the host, or during the DNA replication or the RNA replication. So some people have said this virus is a RNA. Some say it is a DNA. Is there any difference?
DNA and RNA are two different replications. That's for people who do microbiology. But so far, to my knowledge, the coronavirus is an RNA. It has an RNA strand where it has on the body. It has two genes of. It has two proteins and an RNA strand that, when it affects the bronchioles of the lungs, when it affects one of the tubes of the lungs, it then begins to create mucus and then acts like a severe and can lead to severe acute respiratory distress syndrome, which is what we saw. I think we've seen something very similar in the US in 2002, where we had the SARS epidemic, severe acute respiratory distress syndrome, and the coronavirus seems to have the same kind of. So it's kind of like the version 2 of that mutation.
Yes, the reason I asked that question was because now people are moving towards the treatment. Therefore means that if it is a RNA replication, therefore means that it will have other drugs that are in the market that are used to inhibit RNA replication in viruses. We could also test that drug and see if it could follow the same pathway.
Yeah, so you're right. You're right by saying that if we know that it's an RNA, we can find drugs. So far, there have been actually 2 drugs that has been tested, and one of it has actually worked for the virus, but FDA has not approved that medication, and that's chloroquine. The chloroquine that we take in Cameroon or we take in West Africa to cure malaria, and it has worked. So there's chloroquine, and then this recent Ebola outbreak has a medication, Demsivir. I think it's Demsivir. Demsivir that they use in curing. That they gave it to one of the first patients in the U.S. that was affected with the Ebola virus, who came back from West Africa, and he had been infected for I think 11 days. and then he immediately started getting better the following day. So this Demsevere did work for that patient. I think it was a medical doctor, and
I think that was the University of Nebraska where
yes,
they're doing the testing.
yes, and they're currently testing it right now to see if the coronavirus patients can also benefit from that that medication.
Yeah, okay, let's go back to the chloroquine, because now knowing that protozoa, which is malaria, is totally different from viruses. I mean, all of this has to be backed up with some data, like animal testing, like how many patients you've been able to test and able to see how it affects all of these disease. But with the chloroquine, I was kind of skeptical, because somebody interviewed me in the studio. I said I didn't rule out that it could not. I said, but it could, but I still need to see the literature. I could see the methodology, the pathway in which chloroquine will be able to work. But other viruses, yes, we can accept, because, like you explained, if it is DNA or an RNA virus, and we have other drugs that will inhibit the replication of the RNA, we can use the same drug to inhibit the same pathway. We could try and see. I mean, but with the chloroquine, I'm kind of like still a little bit.
So, you and I, we have done microbiology, and you've done genetic biology, where it doesn't, the fact that one RNA medication works for something, it's like AIDS, like HIV/AIDS. So the HIV/AIDS is a very tricky virus where the RNA virus, when it attack your system keeps changing. It keeps the virus keeps mutating so fast that it's difficult to find a very specific drug to inhibit its replication. You can slow it. You can block certain pathways of its replication, but it's difficult to find something to prevent it from happening or to completely cure. It's the same thing with the coronavirus. Not that they will not find a cure. The cure is not that they will not find maybe a vaccine or a cure for it, but there's no effective. None has been approved yet.
Yeah.
And right now, like I said, they're still doing heavy research to find out, what will work and what will not work. And you're right by saying that the malaria, that chloroquine that works for malaria is a completely different medication, because that's a bacteria compared to a virus. And it's possible that chloroquine might not work, but so far it has worked. But they have not done any research, or any data has not been put out to show.
Do you know who was, which lab or which medical facility they were testing chloroquine?
No, that's just something that
is just on social media.
That's on social media, I guess.
Then we can roll that out completely for
now. So right now, I don't want to prescribe. I don't want to prescribe chloroquine. I don't want to say chloroquine is a medication that kills. But somebody that got affected, that was really sick, took it and felt better.
Okay, yeah, Chris. Yeah, this is something that I know in medical practices. Even with the diagnosis that we are doing now with the coronavirus and other virus, because what happened in mass testing, you and I know that, okay, we'll test one person and say, oh, it will test you and you present these symptoms. Any other person will come in and will do differentiation, will check you, will see that you have this symptom. We just include you. We just treat you for that purpose.
For the same,
yes, and it has worked. Yeah, out of maybe 80-90% of it has worked. But now, sometimes it will not work, in the sense that there are different diseases that will have very similar symptoms.
Yes.
Like we talk about coronavirus, they have very symptoms similar to flu.
Yeah.
So therefore means that if somebody is having a flu and come in, I was reading on one article somewhere. When maybe it was somewhere in Africa, in one of the countries in Africa, I don't remember, during the HIV testing, when it hit in the late 90s, or in the 90s, going to 2000, when they were doing some testing, okay, because of the hunger, people that come in that were malnutrition, that were malnourished, they were having diarrhea. So when you come in, the person present the same symptoms as somebody with HIV/AIDS, you rule in. And all of that has been some setback in the medical world, where somebody is diagnosed with this. Then later on you say, oh, they have been declared.
It was a misdiagnosis.
It was misdiagnosed, yes. You know, that false positive and all of this.
So
yeah, with this in mind, how do we clearly say, with this coronavirus that is presenting these symptoms, then with kind of the mass testing, my question to you would be, how effective with all this testing, because you have seen it in social media, even somewhere in China, they say drive-through testing.
Yes.
They are just testing the temperature. Oh, if you have a temperature, you could have a high temperature or fever from somewhere else. How do you correlate that to the virus?
The truth is that, like you rightly said, the coronavirus it presents similar symptoms to the flu. One of the only way to accurately diagnose coronavirus is to do a definitive diagnosis, which you have to obtain a respiratory sputum from the person that is sick, from the infected person, and then test it in the lab and make sure that the virus is actually has the properties of the coronavirus. That's one of the only effective ways to do it. Now, I've seen online of different things that people have presented on how to test the coronavirus. At this point, it's really difficult to say that there's other kinds of testing other than obtaining the sputum from somebody and physically testing it.
Yes, Chris, I think I really want our audience to pay attention to this particular concept, because Chris has a bachelor degree in nursing. He has worked in so many years, and this is somebody who actually worked in a clinical hospital where he is speaking from an experienced point of view, or from where he works and he sees this thing on daily basis. That the real testing, because in communication, in healthcare communication, you will see the news media. I'm not criticizing the journalists or whatever. They will come into news media, they will send out news, very frightening information. I really want our audience to pay attention to healthcare professionals. People like Chris, who is really explaining how you can definitely say, okay, this person is 90% positive of the coronavirus. By testing the temperature, people should not be panicked. If you go to somewhere, they test the temperature and say, oh, you are diagnosed. People should, because I think this is one of the scariest things.
Yes. So let me give a few examples. For example, in the US, the flu season runs from between October and April.
Yeah.
And we usually test almost every patient that comes in with flu-like symptoms. It's not a definitive, somebody comes in coughing, doesn't mean that they have the flu.
Exactly.
Another person comes in and they sneeze one time, sneeze twice, and then you take a sample and you send, and voila, they have the flu. So the only way to differentiate someone that is coughing without a flu and someone that is coughing with the flu is if you do if you do an actual testing, that is the sputum is, or a sample of their secretion is obtained and sent in the lab for testing by a specialist. It's the same for cancer. Somebody can come in, have a bump on their hand, and you see that maybe it's just a scar. And someone else comes in and have that similar bump on their hand, and they take the sample of that bump and send down, you see that it's cancerous. The only way to differentiate is if you have a specialist carry out the testing. Right now, somebody cannot just fabricate a machine and say you're walking down the street and somebody scans your score as if they're checking your temperature and tell you that, oh, you have the coronavirus or not. That's absolutely not correct. That's not true.
This is real information, and this is one thing. This is why I want people like you to come to the studio from time to time to really educate the general public, because there's why panic now, because some of these things from the anxiety, you can just die sometime from this anxiety. People get depressed, like, oh, I've already tested, now I'm about to die. You see, people will get anxiety and they may even die from some other causes. Okay, now moving forward. Now, Chris, I know, because it's a respiratory disease, we know this, and people of advanced age, they are already kind of immunocompromised. It therefore means that when they are infected, somehow the immune system cannot actually fight this virus properly. And I think, I may be wrong here. For this virus to actually cause a disease or to actually kill you, it has to reach a threshold, right? So your immune system is constantly fighting against these viruses. So what are some of the things that people can do to boost their immune system?
So this virus is not, the strand of the virus and the similarities of this virus is not different from acute respiratory distress syndrome, SARS. Or ARDS, ARDS, acute respiratory distress syndrome. And what the virus does in that particular disease, which coronavirus is kind of maybe a mutation of that same virus that attacked people in 2002. What it does is that it attacks your respiratory system, and it dries up secretion, and then it causes your body to go into something called septic shock, which septic shock is so all of your organs become confused, I guess dry up from fluids, and then your organs begin to attack itself and they become very dysfunctional. And what we'll do for people typically in a septic shock is we give them a lot of fluids in the hospital, and then we'll treat them with antibiotics. So it's primarily antibiotics and fluids, and then monitor their vitals and treat their electrolytes as far as you know, so
Yes,
that we
okay.
can stabilize
Yeah,
them.
I think, Christian, what Chris is actually saying is that, yeah, I just want to reiterate this point because I found this point very important. That's why I want our audience to really pay attention. Because you did mention of antibiotics. Yes, in some other subsequent video, I've said people should not take antibiotics to treat the coronavirus. But what Chris is saying is that you have some underlying disease. You may have some kind of infection, like pneumonia in the lungs.
Yes.
So those underlying diseases make you become immune compromised. So sometimes when you go to hospital, they may prescribe you antibiotics to deal away with those disease, so that your immune system can only focus on the coronavirus. Is that right?
Yes.
Yeah. Okay. So
let me clarify. So when the coronavirus attacks your respiratory system, it causes it to develop an infection like pneumonia. Pneumonia is actually the primary infection that it causes it to develop.
yeah.
Now, the reason why a certain group of people, such as little children, like infants, and older adults, are prone to developing this disease is that little children have a compromise. They have little or
Innate
no
immune system
yeah,
that has not completely developed.
yeah, they have not completely developed. So they have little or no immune system at all. And for example, a baby, like a young, maybe a 2-year-old, anybody under the age of 5
Yeah.
has an underdeveloped immune system.
Innate immune system.
Yeah, innate immune system, and they have not been exposed to many diseases enough to build up the strength of their immunity. And then older adults have pre-existing condition. Like you see, many older people are either prone to things like hypertension or chronic kidney issues or some kind of heart issues or maybe COPD or chronic lung problems.
Emphysema,
Emphysema and different things like that. So they're already immunocompromised. Now, when coronavirus does attack them and causes something like pneumonia, that can very quickly put them in some kind of a shock, in some kind of a septic shock. And then that's actually what kills them. It's not the coronavirus that kills them, it's the septic shock.
Sure.
Coronavirus is a virus, unlike the flu virus, where it attacks you, you get sick from it, and then you eventually recover. So for young energetic people like you and me, there's a good chance that if the coronavirus if it attacks us, our immune system will fight it off, because your immune system takes a while to develop the antibodies that eventually fights off the infection. Now that takes sometimes between 9 and 11 days. It depends on how good your immune system is. You eventually recover from it. Now anybody that is immunocompromised, you and me our age, like maybe they have some kind of cancer or they have some kind of disease that compromises the immune system, like sickle cell and different things like that, they will be prone to be sicker than you and me. And it can actually kill them. But again, for little children and older adults, what kills them or what can cause severe problems is a compromised immune system that leads to, so the coronavirus leads to some other infection like the pneumonia, or puts you in septic shock. Septic shock is life-threatening because your fluid is depleted.
Electrolytes are imbalanced.
Your electrolytes are imbalanced. I mean, I can go into the anatomy and physiology of how your vascular system, how your pores opens, and then it causes a cascade of
a lot of stuff. This is a ton of knowledge that I don't think people. This is some kind of knowledge that people are not aware of, and I'm really glad that we are sharing out this knowledge to our people. Now, Chris, you talk of good immune system. Now, the issue is, what can people do? Even though you and I will have a good immune system, what can we do
to prevent the virus?
To just keep the good immune system? Because now it boils down to like having a good, because now the vaccine will take probably maybe 2 years to really come out.
Yeah. So
what can people do? Maybe food, lifestyle, non-pharmacological.
Yeah, non-pharmacological lifestyle is, I think, one of the biggest things that you hear out there is really washing your hands. Washing your hands is one of the biggest factors. Whatever you touch, whatever you do, when you're opening doors, you're doing different things, wash your hands as many times as you can. So not just washing your hands, you want to keep your hands away from your nose and your mouth, which is kind of the entry, the primary. It's called, I think, the T point.
Yeah.
It's kind of the primary entry points of this
Virus
this
into the
virus.
system.
So the virus is, with us in the medical field, we have different kinds of precautions. We have contact precautions and we have droplet precautions. So droplet precaution simply means that somebody who has a disease that coughs, when they cough, it goes a certain distance.
Yeah.
That distance is estimated to be about 1 meter exactly.
That is 1 meter. That is about a yard.
That's about it. An arm's length away from someone. So if you can stretch your arm out and that you touch somebody with your arm, when you cough, the droplets from your cough travels that distance, and then somebody standing at that distance can contract. Or if you cough in their face, it can go into their system. So you want to stay away, avoid overcrowding. You want to wash your hands as many times as possible. Some people wear a mask just to prevent the virus, but wearing a mask can actually cause an incubation of the virus. It can cause the virus to come in and then develop in the mask, and then when you touch it, and then it goes into your nasal system. So washing hands is number one. Staying away from people who cough is the second one. Avoiding overcrowded areas is another one. And just eating the right food.
Okay.
And
to keep your immune system.
To keep your immune system sharp.
Yeah, Chris, I know there's so much that we can talk about this virus. Okay, let's take a little bit further to the economic impact. But even though there were some other topics, but because time is always a factor, let's talk about, because we've seen cases where people now, because of this panic, because of, I still think that because the way the information is being propagated in the social media, you see mass panic where people don't want to go into maybe work, concert, where we have seen organized concert, airport shut down, event, and how is this? I mean, from your point of view, how is this going to impact the economy if this virus doesn't reverse, or if this thing doesn't come to a halt sooner?
I can't speak for politicians. That's for politicians. I just care about the medical aspect, and I can share the medical aspect all day long. Personally, it's already causing problems, because we know that China is like the foundation, or it's the warehouse of things. China makes everything for everybody. They are like the mother of the house.
So when everything is shut,
and when you start closing down things, like right now, it's affecting a lot of travel, a lot of manufacturing. Businesses are all on standby because most of their products that they sell come from many of these places in China that are on lockdown, and if those people are not producing, then the general population cannot consume. The way it affects you and me, especially in the US, there is travel. There's going to be a lot of travel ban coming up in the future, kind of like what we had with Ebola, with people being unable to travel to certain parts of Africa and to certain parts of the world overall. There's been a lot of screening right now. When you go into the hospital, they always ask you, have you recently been to this part of the world? Have you recently been to Italy? Have you been to China? Have you been to Iran? And some of the places that are kind of highly affected. And there are different levels of infection. The economic impact is still coming, still on its way.
And do you think it may be severe if this thing
it's definitely going to get even more severe. Now,
okay, Chris. Yeah, before we go into that, now, okay, I always want to relate the economic impact into the health fee. Now we've seen like common hand sanitizer. We have seen the prices. Excuse me, online skyrocket. A simple hand sanitizer that it used to cost maybe $1 or $2 something. We see it now is maybe it's triple.
People will definitely make profit from things like this. You see, people are buying water. Now, another thing, like you said earlier, on the back, I'm going to back up a little bit. So, people that live in apartment complexes, people that live up, because this virus has a tendency to get into the sink, into the sewage system, and travel its way down if you live in an apartment, or circulate in the water system. So I went to Walmart today, actually, to one of these grocery stores, and I saw that the water aisle, people had bought almost all the water in the store, and they had no hand sanitizer. They had no hand sanitizer. They had no hand washing soap. Most it's so scarce right now. So it turns out so many people were not originally being precautionary enough just with their general health, like not washing their hands when they touch certain soiled or filthy things. They don't wash their hands. But people are taking this really seriously. Say that the general population is taking it really seriously. And like you and I said, businesses always profit. Businesses like Purell that make that hand sanitizer, they would profit. Businesses that would come out with maybe fake flu vaccines would profit because they will say they have a vaccine or they have some kind of medication that cures. And well, my message to the general public is just be watchful of what you buy, and be careful of where you get your information from, and who you're talking to.
Yeah, I think information remain the core, the key as of now, especially like there's so much propaganda out there. I think you have break it down, and Chris, we're probably coming to the end of this show. We thank you again for coming in and sharing your expertise on this coronavirus that is sweeping the world. I mean, we have seen cases, reported cases. We thought it would not hit Africa, but a few days ago it was in Nigeria, and now I think yesterday we heard from the Minister of Health in the Cameroon that one person has been diagnosed with the virus too. So no one is left on, no country or no one will be left untouched with this virus. So we ask you to stay tuned and continue to listen and continue to follow real information. Get your information from healthcare professionals. We are here to provide you the best that we know to reduce the panic that is out there. Please again, thank you for coming in. And until then,
Well, so thank you so much for having me. The one thing I want to tell people is people should keep in mind that in the US alone, the flu virus kills about 60 to 100,000 people every year. And even though we can guesstimate the vaccine, people still get sick, and many people die from the flu. So this should not cause a panic. Stay calm and wash your hands. Stay away from sick people and protect your sinuses, your mouth, and your nostrils, and all that, and you'll be fine. With that, thank you for having me.
Yeah, no, thank you, Chris. Today we'll come to the end of this show, and till then we'll see you again. Once more, thank you for listening to our podcast. Please, if you have not subscribed, make sure you do so, and we'll be waiting for your comment to know how we are doing. Until then, my name is Ernest. Bye bye for now.